Namaste, everyone. Welcome to another episode of the Bharatvaarta podcast. With me today, I have Professor Shamika Ravi, who's a senior fellow at the Brookings Institute, a member of the Economic Advisory Council to the Prime Minister of India, and is among the most recognized people in developmental economics in India today. Her recent perspectives in light of the COVID-19 pandemic have helped us understand the impact of the pandemic, and also that is something that we'll be speaking about in further detail today. So without further ado, welcome Professor Ravi. Thank you so much for making the time to be on the podcast.
Thank you, Roshan. Namaskar to everyone. Very happy to be here.
So as we discussed, we'd love for you to set the context. I believe you have a presentation, so over to you.
Thank you, Roshan. Just a couple of statistics, just to get the ball rolling, because I think data does speak greatly in the current environment. I think some degree of objectivity really helps through the data. That's number one. And number two, remember, we are still in the midst of the pandemic. It's very difficult to conclusively say anything because the science of it, particularly from the medical side, the research is still very much in the initial phases. And yet every day we are seeing new evidence emerge. So the attempt is really to piece together whatever evidence we are picking up from the data itself, while maintaining that the uncertainty from the medical research, the science of it is still an unfolding story. So bear that in mind as we see these numbers. Roshan, I think at the beginning of this pandemic story, it's important to accept one fact, which is that the case fatality rate globally as well as in India is declining, and it's declining rather sharply. And you can see that as of today, it's in the Indian context, we are our fatality rate is about just a little over 2%, and it has been steadily declining from much above 3%. So that's a good sign. And this is a consistent story across the world. Now, what are the reasons for it? Perhaps doctors now have better protocols. They know how to treat patients with COVID. Perhaps we just have a better understanding. Perhaps it's the preparedness that different countries, and particularly in India, since I'm presenting the Indian data, perhaps we have got our act together. So it's important to just see that. Second is, while we do have a fascination for looking at the overall number of cases, and as we should, everyone is, but it's quite alarming in its simplicity if we say that 17.5 lakh cases are there, while not telling people that more than 65% of that, so over almost 11.5 lakh people have actually recovered. And of course, the downside of it is that we have lost a little over 37,000 lives. Now, in the global context, we do know that most countries, when they impose the lockdown, of course, Western Europe, the US, they impose national lockdowns after initial several weeks of rapid increase. And after they imposed the lockdown, they did see a sort of a big decline in the active cases. As against that, what we are seeing in the US, Brazil and India is that we have not yet seen a stabilizing or a decline in the active cases. These numbers are still on an increase. And we can have a discussion on why that might be the case and what is so peculiar about the US, Brazil and India. I might have a few hypotheses of my own. Now, the nature of this virus is such, Roshan, everybody is susceptible. We cannot rule out any segment of the population where we can say that these people will be unaffected. So eventually, if everybody is susceptible, it makes sense to look at the infection and death rate as a percentage or in the form of per million. So population has to be weighed in when we look at the absolute number of cases and the deaths. And here, if you look at the big hotspots, which have more than 300,000 cases, India has a little under 1,300 cases per million. And that is actually quite modest if you consider that the next country, Mexico, has more than 3,400 cases per million. Countries like Chile have above 19,000 cases per million. Brazil has around 13,000 cases per million. So one is, of course, the difference in the magnitude of the infection itself. Yes, it is linked to testing, but we'll talk about it in a minute. That testing doesn't explain the entire difference. Second is the death rate, which is eventually what we're all interested in. That look, this infection is going to grow, but eventually how much can you minimize the death due to COVID? In India, as of today, we have around 27.5 deaths per million people. Now compare that with UK, which has almost 700 deaths per million, or Chile, which has around 510. Brazil has around 450. Now these are very large numbers because while I am deflating them or giving you a sense of the population, in absolute terms, these are very large number of deaths. Now, if we had similar death rate as some of these countries, we are talking about deaths in around 9 lakh, 10 lakh deaths, and clearly India is not seeing that. But just in terms of the cases and what the data is picking out, India is reporting a rather modest death rate compared to other hotspots. We are a very large country. When we start studying all India level statistics, it's a bit naive. It's like saying this is the statistics for Europe. Because every state, I mean, in India is almost the size of a country. And because we have a federal system and health is fundamentally a state subject, different states are undergoing their own sort of evolution in this epidemic. So it's important to see that there are great variations. Of course, India is largely driven by Maharashtra, which has always remained around 1/3 of total cases. And until we really get the infection under control in some of these hotspot states, like Maharashtra, Tamil Nadu, etc., it's very difficult to bring the overall infection under control. But clearly you are seeing that the other states are also now reporting an increasing number. In terms of where the new cases are coming from, again, Maharashtra, Tamil Nadu, and now Andhra Pradesh for the last 2 weeks are reporting very significant large number of daily cases. Now remember, Maharashtra and Tamil Nadu have been hotspot states right since April. We have managed the pandemic or the spread of the infection at sort of varying levels, with varying degree of success across different states. Today, of course, Andhra Pradesh, Karnataka, increasingly UP, Bihar, West Bengal are becoming big problems. If you look at cities or districts, really, the good thing is that districts of Delhi, Chennai are actually beginning to look good because they are reporting fewer cases every subsequent day. Similarly, if you see Bangalore is stabilizing, thankfully. Thane has actually begun to improve, which is the 4th largest in terms of cases. Mumbai has stabilized. While it's not improving, but it's also not getting out of control. So these are the broad trends in the big hotspot cities of the country. Now, while the cases might be rising, the important thing to bear in mind is the differential death rate across different cities. And this is where it's important to highlight that, Delhi has more cases than Bombay, but actually fewer deaths. So Delhi has around, under 3% death rate, while Mumbai has 5.5%. So you have to compare performance and sort of containment and effective management given these kind of metrics, not just the absolute number of cases. Again, look at Chennai, has many more cases than Thane and Pune, but the death rate is much below all India average, and definitely better than Pune, Thane. So Bangalore too, while the cases are rising, but the death rate has remained below all India levels. So those are good things. Now, the lockdowns that we have had, and we've had series of lockdowns, and even today, though we do not have a lockdown, though some states do and districts do, but the growth of the infection, if you look at the speed at which it is increasing, that has been coming down consistently. What you will notice from early June, when the national lockdown was lifted, from then we have struggled to further reduce the spread, and it has remained between 2.5% to 3%. We haven't managed to reduce it further, but that is going to be the nature of this infection, that while states are open, there is a lot of movement from industrial corridor to the eastern states. There will be movement from urban to rural areas. So while we are in the post-lockdown phase, there is considerable movement of people, and therefore the infection rate is still increasing. It hasn't really declined to a zero. So what do we know so far? We have not yet peaked, right? Unlike big hotspot countries of Europe, we have not yet peaked despite lockdown, although we have reduced the growth rate or the speed of the infection. But clearly, this cannot be an all-India story. You have to really pull apart and look at different states differently, and you will see that the performance has varied a great deal across states. In fact, it's we can say with a certain degree of certainty by comparing these statistics that, perhaps it's been a failure of tracing and the effective containment strategies that we have seen very large deaths in states of Maharashtra, Delhi, Gujarat, MP, West Bengal, and as of 2 days back, now Punjab. These are states that have case fatality rate which is much above the all India average. Now, beyond looking at large statistics, Roshan, it's also important because as an empiricist and who's following the global literature on this and how countries are handling it, I must say now we are 6th month into the pandemic. We really need to move beyond mathematical models. Now, while these statistical exercises are helpful in getting a picture, we now need actual estimates of what is happening at the patient level. What are the comorbidities which are particularly debilitating? Whom is this virus particularly fatal, for? The stats that we know are all from the rich countries that have come from the developed part of the world, and we do know that the virus has not been as fatal. Has had varying impacts in India, so we need our own estimates. We would like to know now from the government, from our apex research institutions, what are the exact parameters, not mathematically derived, but actual estimates from the data, right, from people's data. What percentage of our infected people actually need hospitalization? And from hospitalization, how many effectively need oxygen support or ventilators, etc. Now, they should not be left for inference from models. They should really be derived. And I think it's because we do not have those detailed parameters is why there is still uncertainty and sort of lack of knowledge about the virus in India. And therefore, the overall uncertainty around where we are headed, though the numbers are not looking too alarming, but in terms of deaths, but where are we heading? And what will it mean in terms of lockdown for the country and the economy in particular? All India, we have 27 deaths per million, but Delhi has reported more than 200 deaths per million, right? At the same time, you have states like Jharkhand, you have states like Kerala, Punjab, that have reported, much lesser, though of course increasing. That takes us to the testing. Now, one good thing is that our testing rate per million has been steadily increasing, and now we are testing more than 5.5 lakh tests per day. Of course, the idea is to now double it, and that's where fixed capacities are being added in the big economic centers of Bombay, Delhi, etc. But our positivity rate has also been increasing, which means while we've been testing more, the infection has also been spreading. And again, while the WHO says that this rate should ideally not be more than 5%, that means for every 100 tests that you have, you shouldn't have more than 5% infected cases. At an all India level, we are around 8.5, which is high. Thankfully, there is some degree of stabilization now in the last week. But again, it's not all India story. You have to look at the states which are particularly lagging. And one can definitely see, and we've been seeing this in the data for the last 2.5, 3 months now, that Maharashtra, Telangana, these are big states with fast increasing infection where the testing rate has been exceptionally low. And it makes you wonder because these are not poor states. I mean, it's quite understandable when you have low testing rates in Bihar or other relatively poorer states. But Maharashtra, Telangana, these are some of the richest states in the country. So it's important to ask these questions. Now, overall, one important thing is that, look, our economic recovery will go through health recovery because people are scared. There is a great degree of fear, among citizens. And that's why I think it's important to put out information regularly. But people don't consume, they don't invest when they have so much fear. So on the economy, it's not just a demand side problem. It's a fundamental uncertainty problem. Right? And that's why we say that the role of the government then becomes one of dispelling fear and providing more information and battling the uncertainty. Rather than, people say if we did a UBI or a cash transfer, we can overcome the demand problem. I don't think so, because even if you put money in the pockets of everyone, it's not going to translate into active demand one-to-one. People will raise their precautionary savings because that's the nature of consumer behavior. Now, at an all India level, another thing to keep in mind is that, we've been living with infectious diseases for decades now. Of course, we are alarmed at 37,000 deaths because of COVID, but it's also important that all of us realize that, in India, 4 lakh people die of TB every year. So infectious disease is very much a part of a public health concern in India. And this can also be considered an opportunity where we truly build our infectious disease ward. And we build, let's say, testing capabilities, testing labs, diagnostic labs at highly localized levels so that all citizens have access to these basic infrastructure. Now, we have often been using bed capacity as a proxy, but clearly what this pandemic has shown, that number one, public healthcare is where the sort of the heavy lifting in terms of handling this pandemic is concerned. It's mostly been from the government side or public hospitals. But we do have shortage of healthcare workers, and I think that is becoming the binding constraint, and unfortunately not easy to fix over a short run because it's highly inelastic. I mean, from the supply side, we need to really work hard in terms of ramping up, healthcare workers, and we should have more in terms of the training and education part of the story. But just the last slide, economy is contracting. While we are seeing recovery in some areas, we are well below 100% in many. It's a large vicious cycle because it's not just limited to the demand side. The NPAs are naturally, they've been a long-term problem. They will only get aggravated in the current environment. And yet, this will be the new normal. I think firms, institutions, households, we all have to work at a slightly more sort of high cost. We have to invest collectively as a society, definitely from the government as well as from individuals, where, new protocols. We will have to maintain social distancing, hand hygiene, mask wearing. This will have to be a new normal until a year and a half to 2 years when the vaccine is commonly available to everyone, which is the estimated timeline. But until then, this has to become the common sort of a continuous protocol for our day-to-day lives. So I'll just end with that, and then we can have a chat.
Sure.
Yes, Roshan.
That was a super helpful summary. Thank you so much, Professor Ravi. Now, before we can, piece together some of these things, right? And I would love to unpack some of the things that you mentioned in further detail. I just want to ask you, so much of your work revolves around data, right? Would you say India is a sort of a data-starved nation in that sense? Because I find that, we often prioritize other greater things than quality or organization of data. And if yes, I mean, how do you operate in this paradigm?
Roshan, that's been my biggest cause of concern right since March. We are operating relatively blindfolded. That is why, while I put out national statistics and even state-wise, but we know, you and I know that the experience of a normal citizen is impacted by local level details. I need to know where can I get tested. I need to know how many beds are there. I need to know, am I going to be particularly hurt because I have diabetes, right? So these kind of details can only come if we analyze the data. Now, are we data starved? No, I don't think we are data. After Digital India movement, Today we have digitized tons and tons of data. I think what is lacking is the architecture overall to analyze it. I think the research and analytics capability is our big constraint now. Getting data from private hospital is always a challenging task. But even from our apex large public health institutions or from our large public hospitals, it would be worthwhile to look at that digitized data of the patient. So I think it's not as much a shortage of data as of data scientists and analytical capability from, where the government can then work with researchers and make this data available on a day-to-day, in a real-time basis.
Right. So, we spoke about recoveries, being reasonably good, and then, even though infection is rising, right, and fatality is being low and so on. Again, I mean, we can't view it as one sort of a monolith as India, because in a nation of 1.3 billion, I mean, there are probably 5 or 10 countries that we can think of, right? So within that itself. So why do you think some of these things are happening? So for example, why do you think some states are recovering, better than the others? Why do you think some deaths are, what are some of those, can you contrast some of those things that are happening in different places?
I think a scientific temperament, Roshan, number one, can explain the difference between states. I think a scientific temperament right now is one factor that stands out. The second is state capacity. I mean, we take it lightly and we talk about it like a theoretical concept. But you know what this epidemic, what this infection, this outbreak has very clearly revealed to us, that different states of our country have very different state capacity, particularly in healthcare, right? If you see that Tamil Nadu and Kerala and now Karnataka, despite rising infection, have managed to keep death rate low, then to me that is an indication of management as well as public health, infrastructure capacity to manage it. And the management is being done by the local government. And I'm not saying just the state government, it has to run all the way down to district administration. So I think difference in the state capacity in the public health space is, I think, a very important explanation. But the reason I spoke about the scientific temperament is also where many, if you look at the effort, Kasargod and Bombay were two of our earliest hotspots, right? If you start looking at March. Now, when Kasargod had 100 cases, around just a bit over 100, they had done contact tracing of around 20,000 people. It's a good, sort of a proxy or an indicator of how much effort you are making into finding out who else could be infected. In Bombay, when they were about 100, 120 cases, the contact tracing effort was, under 10,000. I mean, now, of course, this is not actual data. This is what we are reading from the press. But that, that just tells you whether you have a containment strategy which involves every part of the district administration. Police has to be a part of it. This kind of contact tracing cannot be done by ASHA workers. That's too, it's wishful thinking, because contact tracing requires you to, first of all, have access to call records, to have access to CCTV footages, to be able to then, validate the credibility of the information you're providing with all this other information, which the police have. Health departments at local levels don't have it. So how well are you working together across departments? And that's the state capacity that I'm talking about. So yes, I think it's the variation in that explains the difference in the experience.
Right. So on balance, how would you say we've handled the crisis thus far? I mean, we had Balaji Srinivasan on the show some time back. I think it was about 3 months back. And, this is the fourth episode that we're doing, I think, on COVID itself, right? And at that time, what he had mentioned was, I mean, India was exceptional in reacting to the crisis in terms of going into a lockdown early and doing a few of those things very quickly. But we should really wait and watch as to how the government handles the crisis going forward. So on balance, how do you think we've handled it? And do you see some key inflection points over the last 5 months?
Well, to everyone who questions the stringency around India's lockdown and whether we were too preemptive, I think we have to look at the pragmatic sort of the constraint we have to work with. We are not OECD country. Our healthcare infrastructure is quite modest, is very limited in many states. So against that constraint, not doing a preemptive lockdown where our numbers were less than 500. In fact, even yesterday, a new PLOS study has come out. And we've had similar studies come from different countries, including from India, which shows that, the numbers would have been much higher. Exactly. Significantly higher if we had not carried out the lockdown. And that you're seeing in terms of the statistics also that, with subsequent lockdown, the speed has definitely come down. Now, what was also, I think, preemptively smart was, getting Indians back from, let's say, China, Milan, Iran, and keeping them separate. So I think in the US, for instance, this didn't happen. While they stopped traffic from China, the Europe route stayed open. And people weren't necessarily mandatorily quarantined for 14 days. There was too much, people went about their life. Now, in the Indian case, what we have seen in the media is, of course, there were lots of high-profile violations. Connected people, movie actors, singers, some of them did jump quarantine, but I mean, maybe that was good press, and that's why it made the story. But the reality is that by and large, most people, they adhered, they actually complied. And I think, so it is as much, the government is a part of it, but I think people have also been, quite compliant. We have not had the kind of debates, right?
Yeah.
Or the big marches around not wearing masks. Now, affordability could be a different issue, but I don't think, I think India has done pretty well, and we should give credit where it's due. Yeah.
Yeah. No, I mean, it always puzzles me actually, the whole masks and no masks thing. I just can't seem to wrap my head around it. I mean, sometimes I feel like, that Vinashakala Viprita Buddhi type of mindset. Yeah, so there's also been that false dichotomy between healthcare and economy, right? So I think Nassim Taleb, has spoken about this as well. But yeah, I mean, going into a lockdown early was probably the wise thing to do. Among the statistics that you also highlighted, one of the things was the number of tests that we're doing per day, and we were kind of late to it, but then we've caught up tremendously well. In fact, I think yesterday it was at about 650,000 tests, and we're targeting 1 million. How important do you think this development is?
Oh, it's fundamental to this pandemic, because testing is really knowledge. Testing is the only way to find out whether an individual has the virus or not, and then you figure out whether to treat and eventually contain the spread and minimize the death rate. Now, but there are different kinds of tests also, Roshan, and I think this is where there is a lot of public discourse and I think lack of clarity that perhaps we are doing antigen testing and not doing the PCR. Now the issue is, we are doing whatever testing the state has the capacity for, number one, right? Antigen tests, while it might not determine the viral load in a patient at that point in time, it definitely, is picking up whether you have the antibodies, okay? And it's much quicker, and therefore, and you can do it at a very large scale. So places like Delhi ramped it up overnight. Now, what we are also seeing from a lot of the surveys which are being done, if you look at the antibody, the serological surveys which have been done, then everywhere, whether it was Berlin, LA, San Francisco, New York, London, in India, we have Delhi and Bombay. And the serological surveys have made it very clear that, look, this infection is far more common than what our current testing is picking up, right? That's number one. But obviously, by extension, it means that it's far less deadly. It's far less fatal. In fact, the fatality rate of 2.1 that I'm presenting now, and of course, we are only looking at a certain kind of test and viral load in the bodies today. But if you actually look at the serological surveys, then we're saying the fatality rate is very, very low. Now, this information is also very important to give out to people so that the fear is overcome. That this is not like some very big problem. And we have never, like I said, TB, if we are losing 4 lakh to TB every year, and we have had 7,500 COVID deaths in 5.5 months. Okay. I mean, we need that kind of objectivity in order to really gauge the situation.
Right. And, one of the things that you also spoke about was the lack of adequate healthcare infrastructure. This crisis is again sort of exacerbated that, right? What makes it difficult in particular is the fact that, even the existing infrastructure is not optimally utilized. There's no data around it. For example, like in centralized, updated data on how many beds or other facilities, ICUs, so on and so forth in a particular region. So you could move people around as well. Do you see that changing going forward, like a central database of sorts?
We have to, Roshan. I think that is the, well, by the way, we have been having conversation around, some states have already rolled out electronic health records. Now, the fact is, how unified can it be? How portable is it? And how do we link it to, let's say, an Aadhaar, or, what is the final architecture which will emerge after this pandemic? But clearly, what is required is more information and better flow of, patient care itself, I think. The second is this big gap which we have always had in India between the private and the public care.
Yeah.
Now remember, the reality of it is that 75% of our OPD, outpatient consulting, is private, which means private sector comprises a very large, significant part of our healthcare sector. Now, how do you rope in the private sector into this larger data architecture? Right? We have not had that. In fact, till date, even now, we are seeing that, like I said, the heavy lifting in COVID care has been done by the public hospitals across the country. So how do you get the private healthcare providers to work together? Now, I'm not saying that the intent is not there. One is the economics of it. Someone has to bear the cost. So it's important to think through how are we going to finance moving forward. The second is, I think it has not helped when state governments have issued FIR against hospitals. So that working relationship, or when the courts step in and say you have to do free testing. We know that the economics of it is just not sustainable. We can do some amount of free testing, but eventually, which private provider can sustainably do this in the long term? None of them. So I think working with the private sector, which is a large part of healthcare in India, will require us to also design policies which considers these kind of cost implications.
Yeah, I think that's sort of a broader discussion, which hopefully this will highlight as well, in terms of working with private players on healthcare innovation itself, because often, they're stifled in the way they do their business. And so that's something that hopefully will improve. There's also this talk of healthcare spend as percentage of GDP, right? Often, when we discuss this, I think it's about 1.15% at this point. Do you personally believe that this is the right amount, or we should improve it? And if we should improve it, then what is that magic number?
Well, nobody will say this is enough, Roshan. Whether you're on the left or right political spectrum, everybody will tell you that this is very inadequate. Now, but the issue isn't just of spending. So first of all, it's important to recognize that as far back as almost 4 years, when the PM announced that the aspiration should be, or we will go up to 2.5% of GDP by 2025. That will obviously not happen overnight. You have to have a roadmap around that. That's number one. Number two, financing is not the only constraint. If you look at the fact that many states are still sitting with underspent health budget,
right,
which means that it then becomes an issue of governance and government capacity to spend the money in the right way, right? So that is the second. And I think repeatedly studies after studies have shown that in states where, let's say, vaccination drives or any large public health programs have been put in place, it's not as much a financing constraint that explains the variation in performance as government capacity constraint. So you need to prioritize healthcare. If healthcare is going to be a department that nobody wants to work in, it is a portfolio that no minister or bureaucrat wants to touch, then naturally, the outcome will be like this. We plug it in with like a social sector, whatever that means. That you're there because you are, bleeding heart, and you're not really looking at this from fundamental human capital. You cannot grow a country on the back of unhealthy population. It's as simple as that.
Absolutely. Healthcare and education, of course.
Very, very.
So to that degree, will the 150,000 health and wellness centers the government has planned under Ayushman Bharat be of some help?
Oh, absolutely, because that, our primary care centers, though if you look at the health and wellness center, these are mostly the sub-center level, which means for every 5,000 population, you are supposed to have a sub-center. But these, the PHCs and the sub-centers are the frontline sort of gatekeepers. So that when we do have an ailment, these are the places we go to. and not to super specialty hospitals
Yeah.
for ordinary, sort of care which should be handled with, at the front line. Now, but that gatekeeping also requires, beyond the physical infrastructure and the equipment, it requires people. And again, it's worth emphasizing repeatedly that today I think it is the binding constraint in the healthcare sector. Financing overall is a concern, and we can keep raising that. But today, the biggest concern is the limited number of healthcare workers we have.
Yeah.
And it runs throughout the supply, the chain. Whether you have a doctor, super specialized doctor, or you have an ASHA worker, well, A&M, or let's say nurses, you have a shortage throughout. And that shortage, unfortunately, cannot be, eradicated overnight, because the training required and the certification underlying is going to take time. But you're also seeing some degree of improvisation. No? When Karnataka said fifth year MBBS students can begin to actually, see patients under the current demand. Or we are seeing in many cases Ayurveda doctors do a bridge course and be able to now see patients. And I think those are all very important experiments, or Sugavayu, the kind of successful experiment we saw in Tamil Nadu, where Ayurveda doctors very successfully transitioned into allopathy care or a combined, let's say, holistic care. These are all experiments which we will have to do even after COVID. Yeah. And remember how many people we lose to the international markets.
Yeah, exactly. So I think that goes beyond saying, right? I mean, which is to broaden the base of medical workers itself that we have. One of those things that we absolutely have to do. Moving on to economy, there's been a significant economic impact as well. I mean, also owing to the lockdowns that have been imposed at various points in the country. And it's impacted some of the latent risks that, we already had, for example, in the banking sector. So how do you see that, going forward?
You see, that is where the economic recovery, when I say, has to go through healthcare. Roshan, I think the role of government at this point has to be to reduce uncertainty. Because, under this kind of uncertain environment, it is not just consumers who are not going to buy, but also investors are not going to invest. Absolutely. Right? I mean, private investment in any case has been a challenge for the last 6.5, 7 years. But the current uncertain environment just adds to that. So I think fighting uncertainty becomes a big issue. Now, how do you fight uncertainty? Through really putting out more information, through going to precision lockdowns and precision isolation strategy, rather than now widespread state level or even district level. Because you see, one fundamental thing we have not put out is that not everybody is equally infectious. From the SARS-1 pandemic that we had in around 2003, the research, the data from then tells us that it was really around 6% of infected people who were responsible for over 80% of overall infections. Which means that if we can actually do good contact tracing and isolate the super spreaders, then overall you can really contain this. Again, I'm talking about data analytics and really getting down to the details of the isolation rather than shutting down the entire state. Because shutting down the entire state is proving to be very, very costly.
Yeah.
The opportunity cost of lockdown has to be now minimized by moving towards more precision lockdowns, smart lockdowns, rather than, this widespread, closure.
Yeah, absolutely. I mean, I think we were discussing this just before we started. At this point of time, I don't think we can control infections through lockdowns as such, right? People are going to resume, daily activity. They say a crisis is a terrible thing to waste. So what can we learn from this crisis, and what, according to you, are some of the steps that the government or RBI can do to, bring the economy back, so to speak?
Well, I think, unlike other countries, if you look at the economic packages, for instance, that we have announced, a lot of them have been heavy on the credit, the monetary side of things. If you look at specific sectors that we have targeted, of course, I think the package has targeted the MSME sector. Naturally, because strategically, a large number of employment, people are employed outside of agriculture in the MSME sector. But if you look at from the banking side, then giving the first loss guarantee, the signal from the government to the banks, public sector banks in particular, is that, go ahead and, invest, give the loans. We are here as guarantors to help you make that decision. And yet from the demand side, we do know that people, overall, because of the fear and uncertainty, you're not going to see this rise overnight. So it will take its due course. That's number one. I think the government very smartly, I think, has not picked winners and losers as far as sectors are concerned. Because when we say airlines, for instance, or travel and tourism, they are the worst affected, definitely, right? One of the worst affected sectors. And yet we don't really know how this is going to pan out. So for any public support or government support to specific sectors then becomes an unsustainable, because I don't think the government really can to pick winners and losers. Given the uncertain climate. So you really have to then pick policies which are overarching policies, which will help you sort of lift the tide, which are broader policies. And I think that is why the reliance on monetary policy, etc., is high. But I think also rightly so, they have realized that this might be a good time to bring in many labor reforms, and the states are beginning to do that. This is a good time to finally bring in some agriculture reforms. I mean, we have not had serious agriculture reforms in India since the 90s, right? I mean, we've had reforms in every other sector. But I think agriculture remains so politically sensitive that no government has until now really come out and, try to restructure it. So I think the attempt at unifying or sort of liberalizing agriculture, it's a very welcome step. But moving forward, I think, but the energy sector, the kind of reforms they brought in, I think those are long term. But I do think, and then there, of course, the education, the new education policy, I think is again a very fundamental need. But I think moving forward, the government will have to spend more and on healthcare. And frankly, I see healthcare as an engine of growth, Roshan. You have to see strategically for the next 50 years, what is going to engine our growth. And I think IT sector did a damn good job in the last 30 years. But moving forward, I think because China and others and the next phase of AI, we have seen many other competitors come up. We should now seize the opportunity and make healthcare another strategic sector. Because globally, the world economy is aging. All these, OECD rich countries, they're aging. And their cost of healthcare is only rising. So all these countries will look for ways of reducing cost. And it is not just personnel, right? It's not just about providing cheap nurses and doctors to the world. It's not just that. It's the IT solution to healthcare. It can be through health tourism. It can be through the entire chain within healthcare. But I think if it is thought through as a strategic sector and we make the right investment, of course, we're doing well on pharma. We can do a lot more. But there are many aspects of healthcare where I think India has an opportunity to emerge as the true global sort of hub, which can carry us through the next 50, 70 years. Because no country, believe me, has managed to reduce health expenses. And I think that should be our opportunity.
So we did an episode on how Uttar Pradesh, Madhya Pradesh and Gujarat are sort of introducing labor and agricultural reforms and what effects that's going to have. You can perhaps link it on this episode. The next question I was going to ask was around this whole geopolitical shift, right? Obviously, because COVID has left an indelible mark. The way the world will look like post-COVID is going to be extremely different. What are some of these circumstances that will favor us, and how do you think we should take advantage of them?
As I mentioned, I think moving forward, one thing is we have to be part of this rising global sort of alliance vis-a-vis China. And I think while our dependence on China, our interdependence, but mostly dependence because we import several inputs from them, I think sort of realigning strongly with global powers, which serve our longer term interests, more like-minded countries, democracies, more liberal democracies, I think will serve us well. The second is, I don't think, China has very clearly revealed its preferences through the actions, the choices that they have made. Whether it was, the Galwan Valley, oh, by the way, we are seeing kinds of skirmishes across the entire range, the Himalayan range, but even economically, it is an opening opportunity, particularly after COVID, that many countries, many large multinational firms do want to restructure and reorganize their supply chain. And I think while this is, it can potentially be an enormous opportunity for us, but it's not going to just land in our lap, Roshan. We'll have to do considerable amount of work to emerge as true competitors to smaller, let's say Vietnam, Bangladesh, other relatively more successful market in attracting some of those movements out of China. So it'll take some work from us, but I do think the way the world is emerging, particularly vis-a-vis China, I think it would serve us well to have a clear economic and larger strategic policy or a vision which serves us well, keeping in mind our young population and our close links with other democracies. A lot of Indians go and study in the US or Europe, in Australia, growing links on the skill side with Japan, technology side with Japan. I think these are all relationships which will serve us well in the next several decades.
Right. So moving beyond economy itself, one of the things that this whole crisis has highlighted is also the way the states and the center have been working with each other, right? And that concurrent model, like how it pans out. Do you think it was advantageous for us, or do you think that there is scope for a fundamental redesign in that?
No, frankly, I think every large federal country, and you are seeing this in the US, you're seeing this in the case of Brazil, and you are definitely seeing that in the case of India. It is not one leader that can drive the fate of even a pandemic in a country. And I think it's quite unfair when India is clubbed together with the leadership style of Mr. Trump or let's say Mr. Bolsonaro. It's quite unfortunate. And yet at a more fundamental sort of the way these democracies are structured, we have a lot of commonality with these countries, which tells you that of course you have central government, which plays a very pivotal role, but health is a state subject in India. The amount of testing that will get done, the protocol for contact tracing, the exact isolation strategies, they are all going to be developed and implemented at the district level by the local administration. And that's where you've seen a certain degree of experimentation. Some states which are willing to, and quite, let's say UP, Andhra Pradesh, we don't give enough credit to these large states. But UP and Andhra Pradesh, they're both seeing a resurgence today, but these are two states which have stayed ahead of the curve as far as testing and tracing is concerned. Right? And at the same time, some of our richer states haven't quite done that well. Now, when you see some of the emerging protocols from Kerala, we have to recognize that we don't know any country or any state which can say we have taken care of COVID. It's a recurring problem. It will be a resurgent problem till a vaccine is available. Right. But what is very clear is that despite high resurgence, the death rate in Kerala or let's say Tamil Nadu, Karnataka are actually pretty low. So, that is, I think, it's testimony to the fact that local administration and state government capacity in the healthcare space is commendable, right? And I think that should be in the long term, sort of the federal structure serves us well. And I, for one, I do not agree that healthcare should be put into concurrent. There are several aspects of healthcare. For instance, when I say that what is our incubation period, or can we have patient level details? Why should we depend on, European sort of experiences to understand COVID better? We have enough of our own data. That research and analytics capability every state is not going to have, because your apex research institutions, ICMR, NCDC, etc., NHSRC, nobody's talking about NHSRC, but these are central government organizations. They have the capacity. Every state can't do that. So there is clearly a role for the center as far as developing protocols, guidelines, right? That they have a great role to play. And also in terms of building testing capacity, right? I mean, these are all centralized efforts. But eventual implementation of a lot of these policies are state level. And I think it should be state level, because I think it serves, that is the best sort of the counteracting force. The demand for healthcare cannot be met from Delhi. I think local state administrations will have to eventually experiment and design and tailor-make their responses to the demands and expectation of their local citizens.
Absolutely. So one of the things, and I would be remiss not to ask you this, one of the things on everybody's mind is, when the hell will all of this be over and we can get back to, life as it was, right? So with all of the data available with you and what you've seen, what do you see an exit out of this realistically looks like? I mean, you could probably give us a timeline and also what that will entail.
So Roshan, in April, I remember a TV channel when they asked me, just by reading the literature and what was happening elsewhere, I had said 1.5 to 2 years is what we should be prepared for.
Wow.
Of course, not people weren't very happy about that. But the good thing is that we should update our expectations. No, it's been 4 months since. We should remember that, look, even if a vaccine is available in 3 months, right, the most successful of them is now starting the third phase of a randomized control trial. It will still take them about 3 months to figure out the efficacy. From then to availability commonly to every citizen in India, it will take time, right? Despite, of course, we have excellent legwork already completed from Serum Institute and, let's say, other vaccine producers. But the fact is that logistics, sort of that natural timeline will take its course. That's number one. And of course, second is the uncertainty of the virus itself. It's not given that it will effectively, it will work. But you are seeing what is happening in Delhi. You are seeing that in Chennai, numbers are coming down and they are controlling it. And I think that is where our green shoots, or in terms of understanding the new normal, is that when the numbers on a day-to-day basis begin to come down, then we do know that, look, if we get, let's say, 800 new patients, maybe 70 of them will require some hospitalization. Most people are recovering, right? And when this happens, we have the necessary infrastructure, we have the beds, we have the oxygen cylinders, etc. I think that knowledge, and more than knowledge, the actual preparedness and regular communication with people can really assuage fears and help people get back to normal.
Yeah.
Now, normal will not mean life as usual. We should all be wearing masks. We should all be maintaining hand hygiene. Perhaps large gatherings of the kind, partying, or for instance, sitting, within churches or within cinema halls, these things will take time, because the science of it is very clear that closed spaces, aerosols, a lot of the transmission happens through markets, closed markets, right? Crowded markets. That's how it spreads. So I think some of those things we should just internalize that we'll have to disperse. Right. But I think every institution, I think schools and colleges, everyone, and I have 2 kids at home. And while the teachers are doing, commendable job of going online and trying to do, also remember what is happening to many of the elderly teachers.
Yeah.
Kids are quite quick. They learn a lot of technology quite naturally. But that transition is very difficult for a lot. And yet they have done a fantastic job. But they're missing the peers. They're missing a lot, everything else that comes with being together. I think schools will also then have to take a call that, can we have more sections? Can we have classrooms with fewer children? Can we have alternate days? But that physical distancing, I think, is a new normal for us for, I think, a couple of years.
Right, a couple of years.
Sorry, that was a very, it wasn't a terribly rosy picture, but I think that is most likely.
No, we can end on something more optimistic. So it's been about 6 months of living with this with the pandemic as such, and it's we've all incurred a sort of a lifestyle change. Any particular quarantine hacks that you have picked up over the last few months?
Well, I think it's a good time to catch up on reading and movies, and I think excellent Netflix. Thank God for a lot of these excellent programs, and I think this is a good time to also be grateful and sort of take cognizance of how lucky we have been. In terms of not just the virus and its eventual fatality in India, but also near dear ones who are hale and hearty and healthy. So I think blue skies in Delhi, which is a rarity. But so we have to thank small blessings.
Right. Okay, that's a fantastic note to end the podcast on. Thank you so much, Professor Ravi. I mean, we've understood a bunch of things around this pandemic. It lends a lot of clarity in our perspectives itself. Thanks everyone for tuning in. This podcast will soon be available on all popular platforms. Until next time, stay safe, take care, and Jai Hind.
Take care.